Are you aware of the different levels of care that's available to you if you're struggling with an eating disorder? Hello, my name is Stephanie. I'm a therapist on Long Island, New York that specializes in the treatment of eating disorders and body image issues. If you like this video or found it helpful at the end, please give it a thumbs up. If you're interested in learning more about eating disorders, eating issues, body image issues, general mental health and well-being, and therapeutic tools, please subscribe to my channel, and I hope you find it helpful. Today, I wanted to talk more about the different levels of care that's available to you if you have an eating disorder, as you probably could already tell by both the title and my intro. Now, let me start by saying, one, why is it important? Why is it important that you know what's available to you? It is important because even though you may have an idea or general idea about what is available to you for help, it's really important to actually know what levels of care is available, for one, and two, knowing what really constitutes the necessity for different levels of care, so that you can make sure that you're getting the proper help that you need. And number two, the reason why it's really important is because if you don't know eating disorders, or maybe you don't really know if you're struggling with an eating disorder or how severe it is, if you need help or whatnot, you'll probably be surprised to find that throughout these levels of care, there's probably a care option that is actually really beneficial for you. You may think that you're not suffering as much, but you may need a level of care, and there's a level of care out there for you. Now, without further ado, let me get into it so that you can actually understand what the heck I'm talking about. All right, so I'm going to start from the highest level of care and work my way down. So the first highest level of care is hospitalization. Obviously, that goes without saying, really. It's when you are hospitalized for an eating disorder, and really that means that you are medically unstable and unsound, possibly needing refeeding if you've been restricting yourself for a really long time. You may need to have something what's called refeeding, which is exactly what it sounds like, but it really is a dangerous thing if you are not getting proper medical supervision. So that is what the hospitalization level of care is for. All right, now moving down is the residential level of care. So obviously residential means that you are living in that care facility for a period of time, 24 hours a day, 7 days a week. And hopefully your stay will be as long as the treatment team recommends and not cut short due to insurance, but that's a whole other topic, so I won't get into that. But when you're in a residential level of care, that typically means that you are medically stable for the most part. There might be some medical complications or issues, but it's not going to be something that's going to, immediately kill you, basically. It's not going to be like you're in cardiac arrest and they're sending you to residential. Obviously, you'd be in hospitalization for that level of care. So residential, you might be dealing with some things medically, but you are also unable to feed yourself properly without proper supervision 24 hours, 7 days a week. So let's say if you're struggling more with restricting food, you might not be able to feed yourself the proper amounts of food that you need during proper times during the day, and within a particular time range that is really appropriate for eating whatever you're eating. Or maybe you purge and you really need to be supervised that you are not going to the bathroom after every meal, and that might be something that a residential level of care, that will be something that they will make sure. Or maybe if you're binging, they're going to give you ideas about what really is a proper meal, a proper balance, to have you involved with that. So this is, again, residential level of care. You're there 24 hours a day, 7 days a week. It can vary from a couple of weeks. It could be a lot longer. Usually, unfortunately, insurance gets in the way a lot of the time. So some people don't get to stay the amount that they need. But again, separate issue. Don't get me started on insurance. That's why I keep talking about it. But let's move on. So residential, as I said, there's going to be supervision. You're going to eat meals with people supervised, with other clients in that facility, with a therapist, with a nutritionist, and you're going to have, that's supervised. You're going to have group therapy, individual therapy, group nutrition, individual nutrition sessions. So that is residential. All right, working our way back down, partial hospitalization, or you might hear of it as PHP. Now, this depends on the program. It's going to look different for every program. Usually, this does occur in a hospital setting, so it might not be as cozy as a lot of people would like, as in you might find a residential. What this means is that you might be a little bit more able to feed yourself properly. You're getting more freedom, and you are able to, hopefully do what you got to do, but you still need help and you still need supervision. So for partial hospitalization, it's going to look different for the program. Some programs you will have like 2 meals and a snack every day. You might go 7 days a week. You might go 5 days a week. But typically you're not going to be there overnight, because overnight is when you'll go home, and that's why it's partial. You're only there usually during the day. Sometimes it might be, 9 to 5, Monday through Friday, maybe, Sunday through Friday. So it's going to look different for each program, but you are having the majority of your meals in a partial hospitalization setting. And you'll also hopefully have nutrition therapy in group settings and individual settings as well. Now, working our way back down, intensive outpatient, also known as IOP. So again, this depends on the facility, how exactly it'll play out. So it might be a couple nights a week or a couple days a week, and you usually will have a process group before and have a meal, a process group after, something along those lines. It might be, as I said, it might vary in terms of how long it is hour-wise and how many days it is, and what meal it is. But usually this is in a group setting. Also, on that note, you will, with regards to IOP or an intensive outpatient program, you should be seeing a therapist and a nutritionist individually. Usually they, if you don't have one already on your own, they will make sure that you're having the proper individual treatment options available to you, because really that is something that you need to make sure that you're having them in conjunction. You can't just go to intensive outpatient and think that that's enough. You really need to have individual therapy and nutrition as well weekly. All right, now lastly is outpatient, which is the therapist that I am. I work outpatient on an outpatient basis. And typically this means that you are able to do, for the most part, what you need to be doing for your healthy self. That does not mean that you're not struggling. That does not mean that you are in, just absolutely doing wonderful all the time. More than likely, you're having eating disorder thoughts. You're having struggles with your healthy self. You do not have to be in any way, shape, or form medically compromised. This might be the first step for you when you're first seeking treatment for an eating disorder. It might be, after you've already had to go through higher levels of care, and that's where you end up at. So an outpatient therapist typically will see you at least once a week. Some clients I see once a week. Sometimes I will see them more than once a week, depending on the situation, obviously individual basis. And ideally, you'll be seeing an outpatient nutritionist as well, and also seeing your nutritionist weekly. As I hope I've addressed in a lot of other videos, and then I got my message across, you don't have to be, basically emaciated to have an eating disorder. These are all things that society educates us or tells us about, but you don't have to look a certain way. You don't have to meet certain criteria. That's absolutely just like a textbook definition of an eating disorder or anorexia, because that tends to be what people think of when they think of eating disorders. So if you think you're struggling in any way, go see a therapist. As you might not know exactly what level of care you belong in. So what I would suggest is just taking the first step, contacting people. I will leave a link in the description below for a video that I did about finding the correct help for an eating disorder, because it is absolutely beyond crucial to make sure that you're finding a therapist that specializes in the treatment of eating disorders, and that will explain all of that in there. But call around, find a therapist locally that works with eating disorders, and meet with them, and they can help to evaluate and determine where you need to be, if they are appropriate level of care. If you can test that out and see how you do in an outpatient level of care, they can help you with that. And really the reason also that I had talked about the different levels of care is because if you are in a hospitalization setting or a residential setting, which are the highest levels of care, usually what you should do is recover step down. So if you're in a residential facility, ideally what's best is if you go through the partial hospitalization, and then go through the intensive outpatient, and then resort to returning to strictly outpatient basis. That's going to be the best for recovery because it helps you to adjust slowly to just real living back in the world when you don't have 24-hour supervision. And the last point that I wanted to make in this video, if you're struggling with the eating disorder, you might enter an outpatient basis and recover. You might enter an outpatient basis and never need you never need a higher level of care. You might end up needing a higher level of care, but let's say that doesn't mean you always end up in a hospital, or that doesn't mean that you'll need a residential setting. So don't let this kind of intimidate you. This is really just to be educational and so that you understand your options, but don't let it overwhelm you in any way. So I hope that this video you found helpful. If you have any questions about recovery or any questions about the different levels of care, please leave a comment in the section below, in the comment section below. Like this video, subscribe, I would appreciate it. And if you're interested in learning more about any of this type of stuff, I have a blog. I will leave a link in the description below, and there's a lot of information about all of this on there. I hope that you found this video helpful, and I hope to see you in my next video. Have a great day. Bye.